Welcome to All Things Cardio Oncology. This is the podcast of the International Cardio Oncology Society. My name is Steve Caselli. I'm the Executive Director of ICOS. Our organization is dedicated to collaboration across disciplines and around the world to facilitate advances in the growing field of cardio oncology. It's a pleasure to have with us today two physicians who've worked together to establish a cardio oncology program, which I'll let them tell you about in just a moment. Our first guest is Dr. Roohi Ismail-Khan. Dr. Ismail-Khan is the co-director of the Cardio Oncology program at the H. Lee Moffitt Cancer Center and Research Institute in Tampa, Florida, and an associate professor in the Division of Oncologic Sciences at University of South Florida. So welcome, Dr. Ismail-Khan.
Thank you. It's a pleasure being here today.
And her colleague, our second guest, is Dr. Michael Fradley. Dr. Fradley is an attending cardiologist and electrophysiologist and an assistant professor of medicine at the University of South Florida. He also serves as the director of the joint USF Moffitt Cardio Oncology program. So welcome, Dr. Fradley.
Thanks very much for the invitation.
Well, it's great to have both of you here today, and I appreciate your time. I wonder first, since cardio oncology is a relatively young discipline, could each of you just sort of tell us a little bit about how your interest in cardio oncology developed? Roohi, you want to start?
Sure, I can go first. Honestly, when I was doing my internal medicine residency, I had a really hard time choosing between oncology and cardiology. They're both very interesting, especially since my husband is a cardiologist and he had graduated from the same program 3 years before me. And I found his work very interesting. But as I did oncology, I did subspecialize in breast cancer. And as you know, in the breast cancer world, we have drugs that we use that have significantly improved overall survival and progression-free survival, but unfortunately have caused increased risk of heart disease. So actually that is what piqued my interest in cardio oncology, because I attended my first cardio oncology conference for that reason back in 2009. And since then I was pretty hooked.
Yeah, excellent. What about you, Michael?
Yeah, so I was training in electrophysiology, and during that time I started noticing there was quite a few patients who were having arrhythmia issues and also had cancer. And I really started to ask myself, what's the reason behind this significant incidence of arrhythmic complications in cancer patients? And that was really right when cardio oncology was starting to become really a more developed specialty. And so I started to pursue it at that point, and talking to people and developing some mentorship relationships with other individuals in the field, and ultimately became more and more involved with cardio oncology.
That's great. And it's my understanding that the two of you have been integrally involved in the establishment of the Cardio Oncology Center at USF and Moffitt. I wonder if you could tell us a little bit about sort of how that came about and how that evolved. How did it get started? What role did you all play? How did this all come about?
I mean, honestly, back when I was starting to get interested in cardio oncology, I had reached out to several administrators at Moffitt to help develop a program in cardio oncology. And it was around the same time that they introduced me to Michael Fradley. And we hit it off. And there was about three or four of us who met for the first time to discuss the cardio oncology program. And Mike and I have had a wonderful relationship, and we've been able to develop a clinic as well as an academic research and education program. And I would say Mike has really led this effort at Moffitt, and it's over the last 7 years, it's become an integral part of Moffitt Cancer Center.
Well, thank you. I appreciate those very nice remarks, and I agree. Roohi and I really have worked closely together from the beginning of the program back in around 2014 in developing this, and I think that, you know, when we first started thinking about this program, cardiology had a presence within the cancer center, but it really didn't have a very clear role or a very clear programmatic vision. And I think that we wanted to establish a much more defined cardiovascular program within the oncology center. And because cardio oncology is at its core collaborative and multidisciplinary, having both a cardiologist and an oncologist involved to help define the vision and the mission, I think was essential. And I think, you know, the two of us just really worked really well together and helped to develop and formulate it.
So I'm going to give you a little bit of an example of how important this was for Moffitt and for USF, especially for our patients. So I have had a number of patients that had heart issues that before we had a cardio oncology program at Moffitt, and a lot of times reaching out to the community cardiologists who may have not been familiar with the drugs we give or the issues with our breast cancer patients or any cancer patients, it was really hard to connect and to be able to take care of the patient properly. But having Mike at the cancer center, having a cardio oncology program at the cancer center helped both the physicians taking care of the patient and the patient feel that they were understood. The cardiologist already knew what drugs they were on. And they knew the importance of how important it was to continue on the medications for their cancer. So it was exactly what we needed at Moffitt.
That's excellent. Mike, do you want to elaborate at all on particularly this issue of patient care and how, you know, working together is so critical in an institute like this?
Absolutely. And I think that really not only is it critical within, you know, a cancer center specifically, but I think it's really critical in any sort of cardio oncology program, whether that exists in your traditional academic center, in the community, or in a standalone cancer institute like Moffitt or MD Anderson. The cardiologist and the oncologist really need to be working together and communicating in order to provide really the optimal oncologic as well as cardiovascular care to these patients. You know, I often say in a situation like this, the cardiologist is first mate, but the oncologist is captain of the ship. You know, we want to work and support the oncologist so that they are able to deliver the most effective treatments for their patients. We don't really want to inhibit that or get in the way of it. We want to support them and make sure that we can maintain good cardiovascular health and safety for these patients. But in order to do that, we have to be working together. We have to be communicating. We have to be able to come up with plans together that make sense.
That's exactly right. Mike, I wonder if we can talk a little bit about one of the most unique things we have at Moffitt that we've started recently, which is a multidisciplinary clinic.
Yeah, I think that's a great idea to talk about in this format.
So just yesterday, Mike and I saw a patient, of course, anonymous, a patient that had issues with her pericardial effusion, and her oncologist not being able to treat her because she was afraid of the impact the chemotherapy would make. So we have multiple patients like this in the cardio oncology clinic that come in for both a second opinion from a cardiovascular perspective and oncological perspective. And Mike and I see these patients together in a multidisciplinary approach. So when the patient leaves and returns back to their oncologist and their cardiologist, they have both a cardiovascular game plan and an oncological game plan. And they feel much more comfortable continuing with their treatment, that someone understands both of their issues.
That's wonderful. That was one of my questions, was just if you could sort of maybe describe how if a patient walks in and they're getting care, how do they end up at your center? What are the triggers that move them to the cardio oncology center? do you meet with all the patients together? Are there cases where one of you will meet with them and then you bring them together? Talk a little bit about how that patient management works.
Yeah, that's a great question, and I think it's something that is a continual work in progress for all of us that do cardio oncology, whether it's here locally at Moffitt or I'd say probably anywhere across the world, really identifying those patients that are best served in the cardio oncology clinic. I think that it's pretty evident that if a patient develops some sort of cardiovascular problem in the midst of their cancer treatment, that would be a natural individual who would make their way to our program. What is a little bit more complicated, and I think we are here working on identifying those patient populations that are at higher risk and who we think would benefit from early upfront cardiovascular risk assessment and the development of different risk mitigation strategies. So one example is the patients who are receiving certain cancer therapies for chronic myeloid leukemia. They can lead to increased vascular toxicities. So the malignant hematologist oncologists are sending all of their patients to the cardio oncology clinic for evaluation so that we can hopefully minimize that long-term risk.
Excellent. Anything else on that, Roohi?
So like from the oncology perspective, we're not sending all of our patients to cardio oncology just because they are starting a high risk drug like say Herceptin, also known as trastuzumab. But there are patients that may have a lower EF or ejection fraction or may have a history of coronary artery disease that we are nervous about starting Herceptin on, that it's very important that they're co-managed by cardiology and oncology. And these patients are sent to cardio oncology very early on, and Dr. Fradley and their oncologist follows them together. These patients, we are more cautious in these patients, obviously, because the drug that we are offering can significantly almost double their survival. So it's a drug that we don't, we of course want to continue, and their cardiovascular status being optimized is so important. And so these patients are followed by an oncologist and a cardiologist throughout their therapy.
Right, and you all are in a really unique position where you're able to work so closely together with patients. Are there other benefits that you see in having a cardio oncology center rather than simply, referring patients back and forth between cardiologists and oncologists and others?
Well, I think the collaborative and integrative approach is really so essential. It doesn't just involve one specific area. It does require a lot of communication. It involves beyond simply the consultative visit. It includes cardiovascular testing that needs to be completed, and then those results integrated into a care plan. So I think coming to an actual cardiovascular or a cardio oncology center is really important because you are able to get that more comprehensive approach to your cardiovascular care in the context of your cancer.
That's
Absolutely.
And now you all were both, very integral in starting this program. And I wonder if you could talk just a little bit about maybe some of the challenges that you faced along the way as you were trying to introduce a new program into, a fairly large and sophisticated both university and clinical setting.
I think initially, when we were trying to start the program, which predates Mike at Moffitt, it was so hard to find someone locally who was interested in cardio oncology because it was just starting. Most of our cardiologists did consults from the University of South Florida at Moffitt Cancer Center, but it wasn't their focus. And there's a big difference between a cardiologist who rotates through, sees a patient once, does a consult, and they never see that cardiologist again, versus a cardio oncologist who knows the drugs, sees a patient and follows them through, and they're the same cardio oncologist this patient follows up with. The continuity of care is so important for our patients. So yes, it was very tough for us to find someone who fit perfectly, and we are very blessed to have Dr. Fradley. But now that cardio oncology has taken off, there are many fellows who are actually graduating from a cardio oncology program who are quite interested and are focused in this. And I think the next generation of oncologists have it much easier than we did, because they know there are cardiologists out there who are already focused on cardio oncology. Would you agree, Mike?
Yeah, I agree completely with those comments. I think that, as is the case with any fledgling program, one of the biggest challenges for any individual that wants to start a cardio oncology program or anything that's novel is demonstrating value to the organization. And I think we were both very fortunate that the leaders of both Moffitt and USF were able to see our vision. But I do think that right off the bat, you do need to come prepared to explain and demonstrate how cardio oncology will be valuable to the organization in whatever way that organization values things, whether it is patient satisfaction, whether it is financially, et cetera. And so being prepared from that standpoint will be essential when it comes to starting up any sort of a program. I think that, also from a cardiologist perspective, you have to definitely be knowledgeable about cancer. You have to be able to communicate with oncologists in their language, and you will lose credibility if you are unable to communicate and have those sorts of conversations. You need to be familiar with the different treatments. You need to be familiar with the different acronyms. And I think that the more you engage, the more you have conversations, and the more trust the oncologists have in you to provide good quality care for their patients.
That's so challenging and so helpful. What do you think are, maybe both of you, the biggest obstacles to, say, somebody who's studying to be an oncologist, somebody who's studying to be a cardiologist? What's the biggest challenge to getting them into cardio oncology? I would imagine, Mike, as you're describing, if I've spent all my time focused on cardiology and now I almost feel like I have to learn a whole new discipline, how do you bridge that gap?
Well, I think that nowadays it's a bit easier because this field has become so much more a part of the mainstream cardiovascular training, and even now into the oncology training. I think when Roohi and I were first getting involved in this, we had to do a lot of this independently and learn on our own. But we're recognizing the importance of this field, and now we're incorporating these educational programs into the traditional training programs for both cardiologists and oncologists. And beyond that, we are now also establishing cardio oncology fellowships so that individuals can spend a dedicated year learning how to take care of these patients, learning how to communicate effectively, getting involved in academic endeavors to expand our scientific understanding of the field of cardio oncology.
I have to second exactly what Mike said. From the oncology perspective, this was much harder when I had just graduated from my oncology fellowship. Although, you realize you spend very little time on discussing cardiovascular side effects of our drugs. In fact, we recently did a survey of Florida oncologists and Florida cardiologists through Dr. Diego Sadler from the Cleveland Clinic. And it's amazing to us that only, say, very few oncologists were aware of the cardiovascular side effects of drugs that very commonly cause cardiovascular side effects, including drugs like 5-FU. So that just tells us that maybe the training on oncology has not concentrated on the cardiovascular side effects, which is really worrisome. And so I think now things are changing, even on the oncology training side, that there's much more concentration on discussing side effect profiles of these drugs, especially with recent papers that have come out. A recent study have shown that breast cancer survivors, they're living longer. 10 years out, these early stage breast cancer survivors survive their breast cancer, but almost 20 to 25% of them have cardiovascular mortality. So that's very concerning. And so with that knowledge, our focus is definitely shifting.
And along those lines, then, could you describe any research that you're involved in, either you personally or as institutions that you're involved in?
You want to tell them a little bit about our breast cancer study that we did when we first started, Mike?
Sure. You know, from a research standpoint, we are quite active, and both with projects that are centered primarily here at Moffitt and USF, as well as participating in projects that are at multiple institutions. But one that Roohi and I worked on here at this organization was evaluating the role of a comprehensive cardiovascular risk reduction program in women with breast cancer who are receiving cardiotoxic cancer therapy, so specifically anthracycline or trastuzumab, Herceptin. And we evaluated really a holistic approach which incorporated exercise interventions, nutrition interventions, nursing interventions to help with psychosocial support, et cetera, to see if that ultimately improved different outcomes. And we looked at things like quality of life evaluations, as well as exercise endurance and vital sign changes, et cetera. And so that's something that we're finishing up and will hopefully be sending for publication in the future. Beyond that, we've had multiple publications in the realm of immunotherapy, working and collaborating with individuals and other organizations, evaluating arrhythmia issues in cancer patients. So it's an area that we are highly involved in and quite productive in as well.
We are pushing cardio oncology to become more involved in early phase clinical trials at Moffitt. Recently, we just presented an abstract, Dr. Fradley and I, at San Antonio Breast Cancer Conference, looking at QT prolongation in patients who are on clinical trials, and a clinical trial that we did here at Moffitt, and the impact that has on both safety and patient experience. And so we realized that cardio oncology should not get involved later on in clinical trials, but right when an early phase 1 studies. And Moffitt is a huge phase 1 site. When it comes to clinical trials, our majority of our trials are phase 1. And so having cardio oncology involved early on will help us manage the cardiovascular side effects earlier so that we can have these life-saving drugs that are found to be more safe for our patients. Sometimes these drugs are ignored and they're deemed not safe very early on, and because of potential cardiovascular effects are just not well controlled.
That is so exciting. You all are really pioneers in this field and you're doing such wonderful work. Maybe just comment on where do you see the future of cardio oncology? Where are some of the needs and where are some of the most exciting opportunities from your perspective?
Well, I think that you know, from my perspective, there are a lot of areas that you know, haven't been investigated at all. I mean, I think that, you know, cardio oncology is exciting in large part because you know, we really are still at the foundational level of this field, both clinically and academically. So there's really so much opportunity to advance the field and our understanding of how to best care for these patients and ultimately, you know, protect their cardiovascular system, both in the short and the long term. But, you know, I think from my perspective, you know, oncology is constantly changing and there's constantly paradigm shifts in how cancer is being approached and treated. And so with the recent adoption of immunotherapies as a very prominent treatment strategy for many different malignancies, I think that we're seeing many unique cardiovascular toxicities and really trying to learn how and why these things occur with the different immunotherapies is an area that's really exciting and has a lot of opportunity for growth.
Good. What about you, Rui?
I see that. So one of the things I've noticed a difference in is that when cardio oncology started, a lot of the cardio oncology conferences had many more cardiologists than oncologists, and I think this field is opening up to oncologists interested in cardio oncology as well, which is very exciting to me because I think I could count on my hand how many oncologists were involved in cardio oncology in the beginning, and it's growing. There are many more oncologists who are interested in subspecialized training in cardio oncology, and ICOS is very involved in developing that track for oncologists. So in the future, I do see a very collaborative cardio oncology clinic or program at academic centers and in private practice.
That's great. Is there anything else that you all would like our listeners to know about the work that you're involved in?
We have 2 new clinical studies that are going to be opening at Moffitt to look at cardiovascular risks in breast cancer patients. One is already open. It's in the metastatic setting through Dr. Eksterman in the senior program. And another one called the Upbeat study will be opening soon to look at patients who are on adjuvant therapy to look at their cardiovascular side effects and protecting their heart while they're receiving therapy.
Good. Anything else from you, Michael?
I would just say that, for individuals that are interested in this field, I think that it's an area that's really exciting. I think that it's an area that you can have really tremendous impact from a patient care standpoint as well as from an academic standpoint, because we are still dealing with something that is in its relative infancy, and that in the end, it's an incredibly rewarding field to be a part of. It's a wonderful group of practitioners that are involved in it. As you can see from, my relationship with Roohi, and we work really great together, and the patients are incredible. And it really is a privilege to be able to be a part of their journey. And I would say anybody that's interested in doing this will find that it is truly a group of people that are really incredible and inspiring.
That's wonderful. I feel like you all really are exemplary in terms of what needs to be multiplied across the country and really across the globe in terms of what cardio oncology is all about. So thank you both for the great work that you're doing. Thank you for your time today. Wonderful to hear of the quality of care that your patients are getting because of the cooperative work that you're doing.
Thank you, Steve.
Yeah. If any of our listeners would like more information about cardio oncology or ICOS, you can go to our website, which is ic-os.org, and there you'll find a number of helpful resources. So thank you both for joining me today.